Hello there, welcome to another edition of myself going public with my mental health journey. Today I want to discuss a bit more on what mania is like to me. So some of the problems I've dealt with, I can kind of see them all being, in terms of the way that I was living, short-term living is what was happening in almost everything that was going on. A bit of ignoring, you're still living in the same world that everyone else is, but ignoring realities. And you talk about a disorganized life. There's a tendency to ignore levels of authority as well. So it is, a bit dangerous. There's a level of danger to other people by being in a state of mania. It's not very healthy for yourself or others, and it is a challenge. So being unmedicated, I would actually argue that mania, although it feels better, is probably less beneficial, in my opinion, a way of living than the reflex, which is in a depressive state, although you're at least thinking more clearly. So there is the significant challenges afterwards, after a manic episode, and despite it feeling, good, people are left with, social problems or family problems or relationship problems or friendship problems. And at least from my experience, I've had all of that, and that's a lot. And I've had a lot of support on the other side of it too, from the same groups of people. But at the same time, it is really difficult to get it through people's heads when one of the problems of mania and bipolar is that they ignore levels of reality or authority. And so to get people to behave so that it doesn't cause more problems, it is a challenge for the people around them as well. So to those people, I'm very sorry. It's kind of just the way that things, unravel, and, people can only get as good of a handle on the situation as they can. It is a challenge. And so that's some of the things that I want to share a bit more about what mania is like: short-term living, disorganized life, willingness to ignore, all the way to levels of authority. Like, that's how much one is willing to ignore, and the danger that poses, just by creating a bit more of an unorganized or an unhealthy scenario, or an unpredictable scenario as well. The unpredictability is not good either. So there you go. That's what today's message is, and hope that that helps, bring in awareness and allows people to get treatment quicker or better, or feel more comfortable being treated for bipolar, because it is worse to let those things go, and you do need to make sure that you're getting your treatment. And trust me, you can feel good on medication as well. So there you go. That's today's message.